Upper extremity, finger projection. This video shows the instruction of finger posterior anterior, finger lateral, and finger oblique projection. The SID value of all finger projections should be set of 100 centimeters, and the respiration is not related to the projection. Finger projections are used to examine the presence of lesions such as fractures, osteoarthritis, or foreign bodies in the phalanges and distal metacarpal bone. Finger PA projection uses vertical collimation to the proximal interphalangeal joint. Finger lateral projection uses vertical collimation to the interphalangeal joint. Finger oblique projection also uses vertical collimation to the interphalangeal joint. You can also conduct a low kVp image or utilize a non-screen cassette if the higher resolution of the image is necessary. For all finger projections, the patient is placed in the sitting position with the filming phalanges perpendicular to the image receptor. In the case of finger PA, align the major axis of the patient's hand and forearm on the vertical axis of the image receptor and spread the fingers apart to avoid superimposition. In the case of finger lateral, maintaining the full extension of the patient's filming finger, flex the remaining finger. At this point, in the case of the second and third finger projection, the lateral side of the radius should be facing posteriorly, and in the case of the fourth and fifth finger, the lateral side of the ulna should be placed on the image receptor. Place a support-like sponge between the patient's finger and the image receptor to immobilize the posture and to avoid the overlap of fingers over the distal phalanges and metacarpal phalangeal joint. In the case of finger oblique, place the patient's hand on the 45-degree angle support block with the full extension of the filming finger. Then align the major axis of the patient's hand and forearm to the vertical axis of the image receptor and flex the arm 90 degrees to place the forearm on the table. For every finger projection, make sure to include all structures from distal phalanges to the distal portion of the metacarpal bone. Upon the evaluation of every finger projection, make sure there's no superimposition over the filming finger by other fingers. Soft tissue and the shadow of trabecular bone should be clearly demonstrated, and the space between interphalangeal joints should be clearly observable in the image. In the image of finger PA, the phalanges should not be rotated. In the image of finger lateral, the phalanges should be in the true lateral position. In the image of finger oblique projection, the phalanges should be in 45 degrees rotation, and the lateral view of the distal, middle, and proximal phalanges and distal metacarpal bone must be observable.